Hello, I'm Jeb Brown. The following brief vignettes are a role play of a hypothetical therapy case, a young woman named Cameron. It's intended to illustrate the use of the questionnaires during treatment at different stages of treatment. Obviously, it must be very simple for brevity's sake. It's not intended to represent real therapy, but rather to give you some ideas of how you might use the questionnaires. The case is fictional. The young woman is an actress. There were no actual clients harmed in the making of this video, but hopefully it will give you some ideas that you can integrate yourself as a clinician. Okay. Hi, Cameron.
Hi.
I understand this is the first time you've been to therapy?
It is, yeah. I'm a little bit nervous, but...
Okay, well, that's reasonable.
Yeah.
Let me start by just taking a moment to ask you to complete this brief questionnaire. It's going to ask you most common problems that bring people into therapy.
Okay.
And you'll notice that then there's some items that ask you to look back at the last session and give feedback. Don't worry about that now, but I'll tell you at the next session. I just have to warn you up front. I tend to be a pretty active therapist, and
okay.
I will suggest things and may do things, but it may not be the right thing for you.
Okay.
And so at the next session, anyway, you have a chance to give me feedback on that.
Sure.
And there's a good chance that
okay.
Are you the kind of person that can give direct, honest feedback?
I think I am. I just really am not in the best spot right now, and
right.
and I feel like I need to get back on it. So I'm here for whatever helps me.
Okay, but you'll let me know if
Yeah, absolutely.
Yeah. Okay,
I'm willing to try things, but I feel like
okay.
I should know what does and doesn't work.
Good. Good. I like that about you. Here,
thank you.
Just take a moment to fill
okay.
that out. Okay, Cameron, thank you for taking the time to do this. This is helpful. Let me just take a moment to look this over.
Okay.
So I see, you're feeling pretty sad, a lot of anxiety, you got some problems with sleep.
Yeah.
Is this different for you? Is this some?
It actually is. I'm not used to.
I see you marked you don't have any difficulties with drug or alcohol. Do you use?
No.
Do you drink at all or?
No, never. Never.
Okay,
and
so
no.
that's okay. So, and I've noticed here you sometimes think about harming yourself.
Yeah.
Have you ever made an attempt before? Have you ever harmed yourself?
I think it's just the thought of it.
Mm-hmm.
I haven't really done anything.
You haven't done that. So, but
I don't want to, but sometimes I think.
So, can we make an agreement that that's out of the question? That you won't harm yourself accidentally on purpose? And,
yeah, I think that's why I'm here.
Okay.
I need a backbone. I need some guidance.
Yeah.
I need to be put on the right path again, and I don't know how to do it on my own. So.
Okay. So, I'm looking at your responses. This would put you sort of in the upper range of the stress and happiness for people coming to therapy.
Okay.
A little more above average. The nice thing about that is that people that come in like you, where they've got a lot of symptoms, but they're fairly recent, tend to get a lot of improvement pretty quickly.
Okay.
So we'll use the questionnaire to look at that and sort of see. But I would feel reasonably optimistic. During the session, we'll talk about some things you can do and some things to try, and we'll look at between now and the next session how how that's working for you and see how it's going. Okay, but I have reason to feel optimistic here.
Okay.
So, okay.
Well, I'm always open to suggestions, and I feel like I know what works for me and what doesn't. So.
And you'll let me know.
I'll be vocal about it, and we'll work together. So.
Okay. Good. Hey, Cameron. Good to see you again.
Nice to see you too.
I appreciate you taking the time to fill out the questionnaire again. So,
yeah.
So tell me how you're doing. What's since the last time I saw you?
So I'm doing good. I'm not 100% yet. I still get sad. I still kind of seclude myself from things that I once didn't do. But I'm being optimistic, and I'm trying some of the things that we talked about. And I feel like my sleep has gotten a little bit better. Mm-hmm. And I still have social anxiety, but I'm trying to work on it. So I'm seeing baby steps, which is okay. I mean, it's obviously not perfect, but it's a work in progress.
Well,
so
sometimes it's unwise to change too quickly. You want to,
Right.
Okay, so I'm seeing that, your sleep looks like it's better. Not great, but certainly better here.
Yeah.
And you feeling more productive at work?
A little bit. I mean, I still shy away at times where I probably once wouldn't have. And I'm not feeling that I'm exactly where I want to be or could be. But I am just trying to keep it in my mind that a work in progress is progress. So
okay. And looking back, you gave me some feedback on the last session that maybe some things could have been a little better, which I appreciate. But let's tell me a little bit about that. What are your thoughts on the last session?
Okay, so I feel like I was just a little bit intimidated simply because this is my first time being in therapy. I never thought I was someone that would need it, young, healthy adult. Never thought that I would actually seek out mental health, but I feel like you maybe already predetermined what just would work for me, and maybe you had an idea of what the issue was when I myself didn't even know what the issue was, and so it kind of turned me away a little bit. I was a little bit intimidated by that because I just didn't know what to expect, and it's hard explaining symptoms to people when you don't know why you're sad in the first place.
So you think I was maybe jumping to some conclusions or getting a little ahead of
maybe just a little bit, but then again, this is a new experience for me, so it was just whoa, quite a bit. But
I appreciate that. I mean, I think that's a good point. And it's all, maybe a bit of an occupational hazard that, we go, oh, okay,
right.
So, but I gotta tell you that I appreciate that direct feedback. My experience is, and working with a lot of clients, that kind of directness, and here's what's working, here's what's not. In the long run, we're gonna probably have a better treatment outcome.
Right.
So I got to say, I appreciate that feedback. So let's take a look, and then I want figure out some ideas. I have some ideas, but I want to hear more about your thoughts.
Okay.
And, Hi, Cameron. Welcome back. It's nice to see you.
Nice to meet you.
Last time I saw you, things were going, pretty well. Tell me how's it going now? How are you feeling?
So I'm feeling better. I'm kind of surprised to see how reluctant I was to come into therapy in the first place, going from where I was to where I am now, because I found out through our sessions that it's okay to be sad and not know why, and it's okay to seek out help, and it's okay to take advice from someone you might not know so well, and if you actually implement it in your life, the changes that you can find and feel, and so I'm feeling great.
Well, I mean, I'm looking at, the questionnaires here, and, your overall, what you're reporting is, really feeling pretty good. You're in the sort of normal level of life.
Right.
Sometimes you feel a little sad, a little anxious, but you're actually, doing real well.
Yeah.
So, one of the questions I've got is, really how much more therapy? Do you need more therapy? I mean, you've really made a lot of changes real fast. You're doing a lot better. But I'm not sure if you really need to reschedule or not. I'm open on that. What are your thoughts? I
just feel like right now I'm in a good spot, and all the things that we've talked about can cover numerous things that happen in your life. As long as you just stick to it, you implement it. But I feel like life can always throw you a curveball, and if it does, I would be comfortable coming and seeing you again, just because it's good to have somebody that listens and have somebody that gives feedback, and sometimes that's just what a person needs. So as of right now, everything's going good, but
I've got a good feeling for you, and I think you're going to be fine. The door's always open, and feel free to contact me when you want to come back in. It may just be a few sessions and talks up and over.
Okay. Thank you. Well, I appreciate all the ideas.
But you had to do it. Nice work. So here's her client ID number. If you click on that, the toolkit will immediately bring you to a graph of all the sessions. So you can see session dates across the bottom. The space in it indicates the time interval. The vertical axis is what we call the global distress score. Higher scores indicated higher levels of symptoms and so forth. All of the subscales are likewise graphed on the same 0 to 4. We're using the mean of the non-missing items on the scales, so they can all be on the same graph. Higher scores indicated greater levels of problems. So if the alliance score, for example, is elevated, it means the client is given feedback on alliance. Now, Cameron came in initially with a fairly elevated score. The dotted green line here is a boundary score. Below that score, the scores look more like people who've never sought therapy. So she came in well in the clinical range and over time dropped well into the so-called normal range. Now, because she typically was not this elevated, wasn't this symptomatic, it would be reasonable to expect fairly rapid improvement. Now, I can also go and check on the subskills we discussed, substance abuse, self-harm, and also ask for feedback on the alliance scale. So we can see initially that she did have some self-harm ideation, but it dropped off very quickly. We see also she gave some feedback here on the alliance scale, and I can pull that up and look at it from the second session and can see that she gave some feedback that she wasn't quite sure. We talked about the things that were important or whether we worked well together, and that was addressed in the second interview. But overall, this pattern shows somebody who has made rapid progress. As I've noted, this is probably 1 out of 10 in terms of the amount of improvement, but who's likely to continue to do well going forward. Additional treatment is not likely to bring about additional progress, so I felt comfortable in suggesting we could space out the sessions, or maybe this was a good time to stop. Other clinicians may have a different interpretation of that, or may want the client to continue a little longer to make sure that that continues to do well, but hopefully this gives you an idea how you might integrate information from the questionnaires into the treatment process.